So we were hearing from Tim Murphy about how Republicans are using the fact that some of the Affordable Care Act websites have been crashing as a great talking point that, of course, this national insurance plan is a massive disaster because there's been a couple of computers going down. And it's kind of interesting to consider why a website might crash. It might have something to do with the fact that, I don't know, people are using those websites. That's right, folks. People, Americans, have this shocking interest in acquiring affordable health care for themselves and their families. It may come as real news to Republicans. It probably comes as real news to people calling their Republicans to demand a government shutdown while they scroll through an exchange website themselves to look for an affordable plan for their families. That's right. According to Think Progress, here is some stats from yesterday. More than 2.8 million people visited healthcare.gov, and some state exchanges also reported millions of logins. New York saw 10 million. That was so New York of me. I said soar instead of saw. New York saw 10 million attempts to reach its site. California reported 5 million visits. 65,000 visited the Illinois exchange and submitted 1,100 applications. 78,000 Kentuckians logged on and completed more than 2,900 applications for their exchange, and 55,000 went to the Colorado exchange. And in local media coverage are leading with headlines about the Affordable Care Act implementation, with headlines like "First Day Rush," "Strong Early Interest," and "High Volume." Those were Wednesday morning headlines for the Affordable Care Act. And let's go to different parts of the country and look at a few examples of real people in real situations who look like they're going to get benefits from the Affordable Care Act. This is according to a story reported by Alabama, AL.com. I believe that's Alabama online, from Montgomery, Alabama. For Joshua Pittman, a Montgomery resident and founder of the Bearded Man Film Company, health insurance is not an assumed benefit that comes along with the job of being a, wait for it, small business owner. That's right, folks. A small business owner. I wanted to use that music, the Mission Impossible music, for Republicans when they hear the word small business, the term small business owner, they should hear that. But a small business owner in Montgomery, Alabama, is excited to sign up for the health care exchanges provided under the Affordable Care Act. Shocker. The article goes on. Because of this, Pittman, along with other Americans across the country, logged onto a computer this morning in hopes of signing up for health care during the open enrollment period of the Affordable Care Act. While Pittman said he considers the coverage provided by President Obama's health care law to be, quote, very comprehensive and thorough, unquote, he acknowledged that the bill does have its flaws. However, the 31-year-old said that it may not be a perfect solution, but it is an improvement. I think there are a lot of misconceptions, Pittman said. People don't research it. Some just hear Obamacare and decide to go against it. Looking at the alternative, it's the best thing for me to do right now in terms of affordable health care. It works out perfectly. He would have ruined a Jimmy Kimmel sketch about Affordable Care Act versus Obamacare if he was asked the question, because he knows what he's talking about. So that's a young man, small business owner in Alabama who's benefiting from Obama's health care plan. Now let's go to L.A. Anita Diaz. She's 26. She's a single mother. And she has a 5-month-old son and a 2-year-old daughter. She works in a job at a department store and has gone without health care, without medical insurance for months in the past, even as her 2-year-old daughter has had some medical issues. She is very excited about the exchanges and says quote, by the time you split up rent, gas, and food, it comes down to making choices. I was lucky they didn't get sick. This is speaking of the time that she did not have health insurance. So she is eager to sign up for a plan in California, and it looks like there might be a plan available for her that is also more affordable. So, real people with real actual lives facing real actual problems look like they may be getting some serious benefits from Obama's healthcare plan. Now, again, that doesn't make the plan perfect, obviously. We all know single payer is the best solution, but this is a significant difference in real people's lives.